Let's talk about how to make sure your baby is safely and adequately fed, especially if you're a parent who is starting off breastfeeding for the first time. I want to teach you two main things. Number one, how to tell the difference between a satisfied and fully fed baby versus an unsatisfied baby who may not be getting adequate nutrition. And number two, how to supplement your breastfed baby if they need it so that you can maintain your breast milk supply and breastfeeding relationship. This is perhaps the most important material that we teach in the Fed is Best book, and it is the most crucial skill you need to have as a parent to safely feed your baby. The way we're going to discuss this is going to be different from how you may have been taught, because I'm coming from the perspective of a physician and a mom who has seen firsthand what can happen if a baby is not adequately fed. Research has shown that true low milk supply, especially in the first days after birth, is very common, and therefore the need to supplement a breastfed baby is also very common. According to the former president of the Academy of Breastfeeding Medicine, about 1 in 7 breastfed newborns will need supplementation in the first days. Research has also shown that more than 1 in 5 mothers will have delayed onset of full milk production, which can require supplementation to tie the baby over until the full milk supply is present. This number is even higher for birthing mothers who give birth for the first time, who are having C-sections, who have higher BMI, prolonged and complicated deliveries, and other medical conditions. First, what is a satisfied baby? A satisfied baby is calm and content after most feeds and can sleep for about 2 to 3 hours in between. They wake easily for the next feed and are able to actively nurse for 10 to 20 minutes, about 10 minutes per breast, then fall off the breast satisfied. Their lips and mouth are moist and not chapped, and for newborns there may be minimal yellowing of the skin limited to the eyes and face. Urine should be clear or light yellow and not pink, red, orange, or brown. These darker colors are signs of dehydration. You should not rely on the blue line urine indicator that is found in some diapers to determine whether the diaper is wet. It should be wet to the touch and should be heavier than a dry diaper. Once a baby is getting their full milk requirement when the milk is in, they should be satisfied after most feeds during the day, except for 2 to 3 hours in the early evenings when more frequent feeding and fussiness can occur, also known as cluster feeding. Cluster feeding, however, should not happen all day, every day for days at a time, because this can be a sign of inadequate milk intake or inadequate milk supply and requires evaluation and perhaps supplementation to adequately feed a baby. A well-fed baby should have 6 to 8 wet and 3 to 5 soiled diapers a day. If more than 6 hours have passed since your last baby's wet diaper, then your baby should get an evaluation. Some have been told that 1 to 3 wet and dirty diapers in the first 3 days is normal and safe and can tell you whether your baby is getting enough to eat. But research and health professional clinical experience has shown that this is not accurate. In fact, babies can produce these diapers even with little to no intake within the first days of life. There are many opinions on what normal weight loss is for a breastfed newborn. While 7% is the average amount of weight loss for exclusively breastfed newborns in the first days after birth, unfortunately, research has also shown that conditions like high sodium dehydration, excessive jaundice, and even low blood sugar, all unsafe conditions that can impair brain development, can begin to increase at about 7% weight loss. Therefore, a well-fed newborn is losing no more than 7% or has proven normal blood work at this percent weight loss or greater. Weight loss should also be no greater than the 75th percentile on the newborn weight loss tool, which we discuss in the book. And lastly, a well-fed newborn should no longer be losing weight by 72 hours. Once they're gaining weight, they should be gaining about 6 to 8 ounces a week or about 1 ounce a day. And their weight should be maintained at or around their growth chart percentile. What are the signs of inadequate feeding? We use the mnemonic called hungry. H is for hypoglycemia or low blood sugar. This condition is characterized by jittery hands, inconsolable and high-pitched crying. If severe, lethargy, limpness, low body temperature, turning blue, and seizures. U is for unsatisfied nursing. Nursing that is lasting more than 30 minutes and occurring more frequently than every 2 hours, and crying despite prolonged breastfeeding, or latching and unlatching looking for a source of milk. N is for not waking spontaneously for feeds about every 3 hours. If they're nodding off during feeds, are not maintaining their latch, or difficult to arouse, they're limp, lethargic, and not feeding for more than 10 minutes at a time. G is for poor growth or excessive weight loss greater than 7%, or weight gain that is less than 6 ounces per week once a newborn starts gaining weight. R is for reduced wet and dirty diapers, or no wet diapers in 6 hours. R is also for red, orange, brick dust in diapers. This is a sign of dehydration. Y is for yellow or jaundice, yellowing of skin that goes past the face. These are not hard and fast rules, but they are signs of inadequate feeding that should make parents and health professionals pay attention. Don't forget to click below for your free guide to safe infant feeding, a guide to help you safely and adequately feed your newborn in the first days of life. You can also get a copy of the Fed is Best book by clicking on the links below. Thank you so much.